Hey, welcome everybody to our community forum entitled Back to School in a Time of Measles Resurgence, Community Protection Through Vaccination. My name is Tony Ward. I'm a professor in public health within the University of Montana's School of Public and Community Health Sciences. I'll be the moderator for tonight's panel discussion and question and answer session. So the idea for this community forum came about several months ago when we started to see a troubling resurgence of measles in Montana. What we were learning is that many public health departments and healthcare facilities have never dealt with measles before. So one of the things that our team did here at the training center and at the University of Montana was to develop a series of video resources to support providers and public health departments that were starting to see patients with measles. So as a follow-up to these creating these video resources, which you'll hear a little bit more in a few minutes, we wanted to also provide an opportunity for the public to ask their questions regarding measles and vaccines, especially during this time of when kids are returning back to school. So tonight, we're hosting a panel discussion. We've reached out to several experts in the field across Montana, bringing folks together to give them an opportunity to answer your questions that you might have about measles and kids going back to school and vaccinations. So we have folks from the state health department, local public health departments, pediatrics, and school nursing. So in the first part of this forum, our panelists will each share some critical insights on what families, schools, and communities need to know about measles, vaccinations, and disease preventions as the new school year begins. We'll also show the many videos that I just talked about, these educational resources that were developed by our team, and we'll share the link with you. And then we'll open it up for the panelists to field questions from the audience. So again, we're going to have just very brief presentations from each one of the panelists, and we'll follow that from a question and answer session. So we've already had a lot of questions that have been submitted during registration for this event. So we've captured those questions. We've kind of weeded out the ones and combined the ones that were similar. So we have a good working list of questions that you guys submitted during registration. We've also had some additional questions that have come up that we're going to ask the panelists to address. If you have an additional question that comes up, please just place it in the chat, copy and paste it or type it in the chat, and it'll go to our team, and we'll make sure we'll do our very best to get that question answered. So please note that this meeting is being recorded, and this recording will be available on our website following following tonight. And also note, because there's a lot of people on this forum, we're going to keep all cameras off, other than myself and then the panelists that will be speaking. And we're going to keep the microphones muted too. But if you do have a comment or a question, please put that in the chat and we'll see it. So you might see Anna Kiley, who will be helping us switch slides and providing IT support. So Ms. Kiley is the operations manager for our Montana Public Health Training Center. And she brings a lot of expertise related to teaching in the classroom in school, middle school, high schools throughout the years, and working in public health. So she'll be helping us fielding the questions and also providing IT support. So first off, we are going to introduce Ms. Brooke Krenninger. So Brooke will be providing a short presentation. Brooke is in her 6th year here in Missoula as the Health Services Coordinator from Missoula County Public Schools. So prior to that, she worked in infectious disease and cardiopulmonary clinical research, biosafety lab, level 4 exposure training, clinical analysis, and critical care nursing. She received her Bachelor of Science in Nursing from Indiana University and her Master's of Public Health from the University of Montana. So I'm going to turn it over to Brooke.
Thanks, Tony. Well, I'm going to start off just talking a little bit about measles and what it is. Many of us have never known anyone with measles or seen anybody who has it. So we can go to the next slide. Uh, Measles is a highly contagious airborne virus with an R naught of about 12 to 18, which means one person can infect about 12 to 18 other people who are unprotected, either from a vaccination or having had the virus before. They can infect up to 90% of the unprotected people around them, with close exposure. Symptoms of measles usually begin about 7 to 14 days after infection. Include fever, cough, a runny nose, conjunctivitis, or like puffy eyes, copic spots, little spots in the mouth, and that characteristic measles rash that you may have seen pictures of. Um, Children under 5, adults over 20, pregnant women, and people with weak immune systems are especially vulnerable to the complications of measles. Measles spreads through coughing and sneezing. It's airborne. You can touch contaminated surfaces and then touch your eyes, nose, or mouth and infect yourself that way. And the virus can live for up to 2 hours in a space after an infected person leaves. Next slide, please. So we talked about there are those groups of people who are pretty vulnerable to complications. What are those complications? Things like ear infections, diarrhea, pneumonia, acute encephalitis or inflammation of the brain, death, unfortunately, and then a rare but very serious and usually fatal condition called subacute sclerosing panencephalitis, or SSPE. All right, next slide. And measles, we have a vaccination now, as everybody knows, but before the vaccination, what did it look like? Globally, about 2.6 million deaths per year could be attributed to measles. In the United States alone, we would have about 3 to 4 million infections per year, with 400 or 500 deaths, 48,000 hospitalizations per year, and about 1,000 people would get encephalitis, many of them not recovering fully and having lifelong complications. Next slide, please. That long-term sequelae of the infection, so you can have the complications, you might still recover, or you can have the long-term infections that affect you for life. And those can be anything from an intellectual disability, a developmental delay, motor impairments, the SSPE that we talked about, and then sensory issues such as hearing loss or blindness. So this is not just a benign virus. It's highly contagious and it can cause some problems. Before the vaccine, most people had measles by the time they were 15 years old. And most recovered okay, but those ones who didn't, it could be very serious. And considering how contagious it is, it could just spread rapidly through unvaccinated population. So even if it's a small percentage of people who have these complications, as contagious as it is, it can impact a lot of people in an unvaccinated community. Next slide, please. And just very quickly, just to give you an idea, using Missoula County Public Schools community, which is about 10,000 people, as an example of how many people that could impact if we had no vaccination. We could have up to 2,000 kids and staff hospitalized, 500 develop pneumonia, 10 just in our school district develop encephalitis, 10 to 30 could die, and one could develop that delayed neurologic issue of subsclerosing panencephalitis. So the impacts are large. But fortunately, and we can move on to the next slide here. Fortunately, we do have a vaccine. The vaccine has been around for a long time. In 1963, it was developed, and then around 1971, it developed into the MMR vaccine that we still have today. And then in the late 80s, early 90s, they adopted that 2-dose schedule. Next slide, please. Which then that 2-dose schedule gives us 97% effective immunity. So it's 2 shots, been around for a long time. Someone else is going to talk more about the vaccine itself later, but that is what we have now, and it is pretty preventable. Next slide, please. So I've gotten a few questions about why are we having outbreaks? Has measles changed? Has it mutated? No, it is still the nasty, highly contagious virus it has always been. Our behaviors have changed somewhat. We do a lot more traveling, people coming in and out of our country, but also, unfortunately, our vaccination rates have dropped in the previous years leading up to these outbreaks that we're now having. We need about 95% of a population to be immunized to have what we call herd immunity. And I think everybody has heard of that. And we are slowly dropping below that in some of our communities. And that's now why we're seeing some outbreaks. Next slide, please. And so what do we do about it in Montana? Here in Montana, we do have state requirements that every kiddo who goes to school is required to have 2 MMR shots or a valid exemption. And there are 3 different types of exemptions. We have religious, medical, or conditional. The conditional one is for those people who maybe couldn't or didn't get the vaccine previously, but they're in the process. They can file that paperwork and continue to attend school while they are getting vaccinated. I know I only had about 5 minutes, and I know that was a lot of information, a little crash course, very quick. And we can go to the next slide, which is just a summary. Oh, actually, I think my slides got out of order. I apologize for that. I was on a different slide. MCPS, I get questions a lot. What would we do if we had a case of measles in our schools? I cannot give you a canned answer because there are so many factors that go into the response. But what I can tell you is that I'm immediately going to be on the phone to Missoula Public Health, who are wonderful. We are going to collaborate and investigate the case, decide what our next actions are, decide if people need to be notified, see if there are any environmental actions that need to happen, such as cleaning, closing areas, closing schools or classrooms, identify people who may be at risk. We keep a list on the ready of all of our unvaccinated students and mostly staff, as well as our kiddos with conditions who may be at risk. And then we're going to then consult and follow our MCPS outbreak plan. And finally, we're going to communicate to our community what is going on and what we're doing about it. And that is about all I have. I think my last slide is references, if anybody's interested in seeing those. And I'm going to turn it back over to Tony.
All right, thank you very much, Brooke. So next up, we have a speaker from Montana Department of Public Health and Human Services. So Jessica Lokman is the Communicable Disease Nurse Consultant at Montana DPHHS, where she serves as the state's lead epidemiologist for vaccine preventable diseases, with a special focus on measles. With 15 years of nursing experience and 5 years dedicated to public health, Jessica brings a wealth of experience and a passionate commitment to protecting communities through effective disease prevention and control. So take it away, Jessica.
Thanks. So I'm just going to review kind of what's going on both nationwide and then here in the state of Montana with measles. Next, please. So these are just some quick numbers about what had happened previous to measles before this year. So this graph shows incidence, so how many cases of measles per 100,000 population. But you notice that big spike in 1990, and as Brooke just mentioned, that's when the second dose of the 2-dose series was recommended, and we had that sharp decline after that. And since that period, we've had very low numbers of measles since that time. Next, please. Here in Montana, similar kind of thing. We've had very low numbers longer than since 1990. Our last case prior to this year was in 1990. We had 6 cases that year, and we'd had no cases up until this year in 2025. Next, please. So the national picture for measles, this graph looks at cases per week. So it's the week that they're diagnosed, starting in 2023. And then you can see at the beginning of 2025, there on the right side, a very sharp incline in cases. Quite a few of those are related to what has been known as the Southwest outbreak. Those are cases in Texas, Oklahoma, and New Mexico. And we have been seeing reduction in cases in the last few weeks. Next, please. So overall in the United States, this data was pulled on the 11th of August from the CDC website. Had a total reported of 1,356 confirmed cases. That means those cases either had laboratory evidence of measles or had a direct link to somebody who had measles, so that we know that they were exposed to somebody. Of those cases, 92% of them were either unvaccinated or we don't know if they had a vaccine. 13% of the cases were hospitalized. This is a little bit lower than we typically see, and we're still monitoring this as the cases continue. And unfortunately, we have had 3 confirmed deaths related to measles, 2 of those in Texas and 1 of those in New Mexico this year. Next, please. So what's going on in Montana? Montana, we have had 31 cases of measles as of yesterday. We did unfortunately pick up 1 new case yesterday in Lewis and Clark County. A majority of the cases have been in Gallatin, and that's because there have been a couple outbreaks of measles where we've had larger numbers related to measles exposures. Next, please. And this is our dashboard that we keep on our website. This dashboard is updated every morning, Monday through Friday, except holidays. And we want to keep it updated so that you, the public health, school operators, parents, whoever you are, that you are up to date with what is going on with measles in our state. It has our current case numbers, 31 cases, our most recent case in Lewis and Clark County. And then it shows on the bottom graph there, we have 2 different kind of numbers. We have the lighter blue, which are recovered cases, and then that darker blue, which is a recent case. And recent, really, it's the time period that public health, and it may be schools, it may be a lot of different places, healthcare facilities, they're in a reaction mode to that measles case, and there's a lot of activity related to that. So we wanted to highlight that period because there is a lot of activity for the first about 25 days after a case has a rash onset. Next, please. And Brooke mentioned vaccination rates, how we need to have at least 95% of our populations vaccinated against measles to really provide that herd immunity and prevent measles outbreaks in our communities. Unfortunately, we've been seeing declining rates over the last few years. The most recent data we have from the National Immunization Survey is through the year 2023. Now this graph here, green is going to be your United States overall numbers and blue is going to be your Montana numbers. But it shows kiddos at 24 months, the percentage of those who have had at least 1 dose of MMR vaccine. And as you can see here in 2023, only about 85% of our 2-year-olds have had 1 dose of MMR vaccine. Next, please. The other age that they look at for the National Immunization Survey is our teenagers, our adolescents between 13 and 17 years. And they look at if that age group has had 2 doses of MMR coverage. And again, United States here is in blue, Montana is going to be in orange. These numbers are a little bit better. 92, almost 93% of our teenagers have 2 doses of MMR coverage. But if you do notice, it is it's smidging down each year. So it's something that we do need to be aware of and keep vigilant and make sure that we're keeping our communities vaccinated, because that's what's going to protect us and our neighbors. Next, please. And I wanted to show you guys just some resources that I use and I know might be helpful for school environment. That first link there is the dashboard for our that I showed you earlier. It is updated every day, every business day. The second is what's called the Preparing and Responding to Measles checklist for K through 12 schools. This is about a 2.5-page document that has different activities that schools can both prepare for measles and what to do when you have a case of measles or suspect you might have a case of measles in your school environment. And really walks you through, these are the first things you need to do in the first 5 minutes to do. And really can help guide planning and then activities when you do have a suspect or known case of measles. The third link there is the prevention and control of respiratory and gastrointestinal infections in K through 12 schools. It's a little long, but it's got some really great information about how to prevent infections in general in our school environment. Fourth link there is the Communicable Disease Guide for Schools and Daycares. This was something put out by DPHHS. We update it every 5 to 8 years or so. And it goes through different illnesses that we typically see in both our school and daycare population, what to do. Both there's guides for what diseases and there's guides based on symptoms, because sometimes we just know kiddo showed up with a fever, but we don't know what that means. And then the last tool down there is the EpiEngage Measles Outbreak Simulator. This was a tool designed by the University of Texas where you can put in your population for your school, your school's vaccination rate, and then kind of play with it. What would it look like if one person showed up to school with measles? What might that look like in an outbreak situation? What if maybe we had a family that unfortunately had measles and all like 3 or 4 kids showed up at one time with measles? So that's something that maybe could help kind of plan, spark some conversations about what your school might do. And I believe that is all I have.
All right, excellent job, Jessica. Thank you very much. So next up, we have Erin Ritchie. So Erin Ritchie is the school and excuse me, school and daycare nurse for Jefferson County. Her goal is to work with schools and daycares to help create a healthy environment for children to thrive. So go ahead, Jessica. Erin, sorry.
That's all right. Yes, hi there. Yep, I'm Erin Ritchie, and I'm the school and daycare nurse for Jefferson County. So I'm coming at this from a perspective of a school nurse, but also from public health. You can go to the next slide. So, so some of the things that we've done in our community to help prepare is back in January, well, actually last year, we kind of started noticing a trend in the upward measles cases throughout the nation. And we knew, okay, that could come knocking on our door at any time. So maybe we should start looking at this a little bit more, because as we talked about, none of us has ever dealt with measles before. So we decided to put together a measles tabletop exercise, and we invited partners from all over. We had our whole health department, our sanitarian, DES, safety, FEB, and a bunch of our local school representatives. We tried to have some local providers come in as well, but they were pretty busy, so we weren't able to get them to the table. But then we worked through a scenario about if measles came into the school, what would that look like and what would we do? And we all worked together and came up with a plan, and it was really effective. We followed that up several months later with a Measles 101. And we invited back our local school representatives and school nurses, and our health officer put together a really wonderful presentation that was just really short and sweet and exactly what we need to know for our schools about what it would look like if something like that came into our schools. That was really effective. To get out to our community, we are putting a measles update on our social media that links directly to the state dashboard, as well as other pertinent information, just to keep our community aware of what's going on. We also put out newspaper articles and newsletters to get information out to our community, to our schools, to our daycares. And then we started doing personal visits with our local medical providers. My supervisor would go out and actually meet with them and say, hey, you know, this is what's happening. This is what we need to look at. And can we have that really good communication? So if something does come, we are working together very quickly. And that was actually very effective for us because we did have an issue where we thought we might have something. And we worked with our provider and we were able to go pick up that sample and take it directly to the state lab. So we had a turnaround time for that lab the next day, as opposed to that provider sending it out and maybe having a couple of days lag time, not knowing if that was a positive specimen or not. So that was really effective. And then we provide our schools with that communicable disease guidelines. We provide a hard copy to all our schools and our daycares. That's something Jessica was talking about. And that's really nice for everyone to have, because then we can just flip through. They have a little blip on there. What do I do in this situation? And it's really nice. You can get it PDF online as well. So everybody should have that resource. And then just continuing with the annual school and daycare immunization reviews, because that's also a really important piece to know where we stand. And we can go to the next slide. And we already talked a little bit about that herd immunity, right? What that looks like and why we want to know what our immunization rates are at, because we want to know what our immunity is at, right? So it's also called community immunity, which I prefer that term much more. It sounds cool. But our threshold for measles is that 95%, right? That's the one we say if we have 95%, we're sitting pretty well. We have a pretty good veil of protection. So we can go to the next slide. And so I have been tracking for Jefferson County schools. We haven't been able to track since 2021 for schools in Montana. And you see our little sad map there. Montana's all gray and sad because we can't track the schools anymore. But we had been doing it up until 2019. And that school data said that we were roughly 96% up to date as an average for all of Montana for school required vaccinations. So we did have a pretty good veil of protection according to that data, and you can look that up as well. And for Jefferson County, we've always been a little bit behind. We kind of got up to that 95 mark for a little bit, and then we dropped off again, but we're sitting right about that 94%, which is pretty close. So we feel pretty good about it. Our daycares were sitting at about 100% last year, which was awesome, but we have to remember that in our daycares, we still have that vulnerable population of those under 1 year old who aren't able to get vaccinated for a lot of things or be fully vaccinated yet. So even though we're 100%, there's still that vulnerable population there. Okay, next slide. So what we really want people to know from our perspective is that the numbers may seem small. They're like, oh, 31 cases, but that is what we are trying to achieve, to keep the numbers small. That's when public health has the best opportunity to keep this controlled and to kind of keep it from getting outside of that little numbers that we like. So we are working really hard. It may seem like we're doing an awful lot in that time with that small numbers, but that's why, because we have an opportunity when those numbers are small to make some big change and make sure that doesn't get out of control. And our goal is to maintain a healthy environment for our entire community, our entire school, our entire daycare, right? For everyone to be able to be healthy and happy. And that's what we're really working for, right? And so it's always a good idea to be prepared, know your immunity status, stay up to date on available vaccines, and focus on staying well overall, right? That eating a balanced diet and exercise and washing your hands and all the things that we know are able to help keep us healthy through the year. So we want you to remember it takes a village for all of us, but we do better working together. So work together, working together with us, public health, schools, our community, working together is everything. And that's how we're going to get through this. That's all I have. Thank you.
Thank you, Erin. So next up, we have Lauren Perry. So Lauren, it works in communicable disease at the Gallatin City County Health Department. She's worked there for several years. She supports disease investigations and outbreak responses. She's currently in her final year of the Master of Public Health program at the University of Montana. So welcome, Lauren.
All right, thank you everyone for joining us today. I am going to talk briefly about some lessons learned in Gallatin County, having navigated increases to vaccine preventable diseases over the last year, including 19 measles cases. And I really hope to just encourage strong partnerships and their role in response and encourage proactive measures to know your population. So we can skip ahead 2 slides. Perfect. So Gallatin County has had 19 confirmed cases of measles in 2025, and thankfully, none of these occurred in a school setting. And even though schools have not yet been impacted, we really do need to be prepared for the possibility that measles could enter a school community in the future. And one of the most effective steps that we can take is sending out proactive educational messaging to both schools and parents and guardians. And it's also essential that those materials are available in multiple languages. So in Gallatin County, all of our correspondence from the health department is typically provided in English and Spanish. But if your specific school community has families who need materials in other languages, it's really important that that's communicated back to the health department so that we can make sure that everyone is getting access to materials in their preferred language. And additionally, the local and state health departments are a great resource for information. So schools making those references available to their school community so that everyone can stay up to date on the information that's being shared both locally and at the state level. And it's really just important to remember that these situations are evolving constantly. You can be as prepared as you think you can. And when measles cases do come on, enter your community, it's an evolving situation. And so the best thing that we can recommend is just really proactive and flexible responses. And that's the best way that we can keep promoting those healthy communities. Next slide. And one of the most important lessons we've learned is the value of strong relationships among all key partners. So local health departments do play a central role in referrals to care, but schools may also be the first ones to receive information about possible cases and are the ones to initially help connect those students and their families to local care clinics. So prompt notification to the health department is critical for managing that risk and determining next steps. And it's also important for schools to be familiar with the available resources. There's insurance and coverage limitations that can sometimes create barriers for individuals to seek care. So the health department really does serve as a great resource to help navigate those challenges with school staff and parents. And again, just that information sharing among partners. When we have partners that are connected and openly communicating, our follow-up is typically a lot smoother and more effective for the families and the school community. So next slide. So in the spirit of being proactive, we just really strongly encourage schools to have a baseline understanding of their population. And for schools, what this means is just having general awareness of staff immunization rates and whether or not your workforce is protected. And it also includes knowing your student vaccination rates and exemptions. This can help highlight where your school community may be a little bit more vulnerable. And schools should also be aware if there are students or staff who are especially susceptible to a severe infection. And for parents, we really encourage conversations with your child's care provider to discuss protections against vaccine preventable diseases. And overall, the goal is just to have that clear sense of risk ahead of time so that you're not scrambling as much to gather that information if measles cases were to arise in your school community. Next slide. And please just know that your local health departments are well equipped to assist you if cases arise in your local school community. And we are just really wishing everyone a healthy school year ahead. So thank you.
Thank you, Lauren. So next up, we have Gina Miller. So Gina is the Director and Chief Health Officer of Missoula Public Health. She's worked in public health for over 18 years and earned a master's in public health from University of Montana in 2016. So take it away, Gina.
Well, I don't know if it's disappointing or if it is a blessing, but I don't have any slides. And I did that because when I looked at the order of panelists, I thought there's some really amazing public health folks and nursing experts on here, and I probably would have repeated a lot of it. So I'm going to run through some notes and try to highlight kind of the role of public health in general, and specifically what it means to be a health officer in Montana, and maybe just amplify or add a little bit of detail to some of the recommendations or points that have been made by previous panelists. So I'll start by saying that, of course, the broad goal of public health anywhere is to protect the community, to prevent disease and promote healthy and safe behavior. And of course, in addition to those overarching objectives, it gets very specific in state law when it comes to what a health officer does in their community, what they're able to do, what they're obligated to do, and that list is broad. One of those things is that a health officer is specifically required to take measures to stop the spread of disease in their jurisdiction. And very generally, we do that by taking the steps that you've heard a little bit about. We facilitate and encourage folks to report communicable diseases really quickly. We want to ensure that people who are infected with a contagious disease are taking measures to limit and prevent transmission. And then we engage in contact tracing, which I think is a term that became really familiar to folks during the pandemic, and maybe they hadn't really heard of that beforehand, but that's quickly identifying possible exposures. And as you've heard, that's so important with measles. If 90% of our unprotected folks are really at risk for catching this disease in a airborne transmission setting for, can hang around for 2 hours, those identifying exposures is really important. And contact tracing oftentimes is identifying individuals who a positive case may have been in contact, or even you may have seen in our state some public notification of public exposure. So, most recently it was identification of a flight. We had a positive case, somebody who was infectious while they were on an airplane. And the point, of course, is to let people know if, know your immunization status. If you were on that flight, if you were in the airport around that time, monitor yourself for symptoms. Please consider getting vaccinated and limit contact with others. Again, for a lot of folks, I don't know, the pandemic really shone a light on public health for better or worse in lots of ways. And I think a lot of people didn't know about quarantine, isolation, contact tracing. But the truth is that's a very old and very effective playbook. We do this work at Missoula Public Health every day. Public health in general has done it for over 100 years. With a long list of contagious diseases. This isn't specific to COVID or to measles. It's not something that was, just made up. I think that it's just that it rarely plays out in a public way or on a massive scale. And honestly, that's the point. That means we're doing our job. Ideally, through healthy behaviors and prevention measures, and most importantly, vaccination, we're able to live our lives without worrying about contracting diseases all the time. We're dealing with large-scale disruptive disease outbreaks. And then I'll just touch a little bit upon preparedness and, things that we've done here in Missoula and that we have found successful. We have made clear with Brooke and others in the school setting that we're definitely a partner. We're in this together, and we get together and practice. We do tabletops. Maybe more importantly, we establish relationships and trust before an outbreak so that when that happens, you're not talking to somebody for the first time. You kind of have your roles defined and expectations set. Get together, run through some likely scenarios. An outbreak is pretty stressful. It can be really complicated, but being prepared ahead of time can really help with that. And then the final point I might mention is we really encourage schools and daycares to know down to a person immunity status, have those documents organized and clear and on hand. you know, in the event of an exposure, unclear or incomplete records is really going to slow down all of our collective response time. That increases risk. And the last thing we want, I think, to Lauren and Aaron's point, is incomplete or inaccurate information going out to school administrators or staff or parents especially. So I think records are important and practicing together is important.
Okay, thank you, Gina. And I know a couple of questions have come in as the panelists have been speaking, and we will put those into the list of questions that we'll post to the panelists in a few minutes. So we're lucky to have Dr. Addie Moriarty join us. So Addie's a pediatrician here in Missoula, and she's also a president of the Montana chapter of the American Academy of Pediatrics. So welcome, Addie.
Thanks, Tony. And as usual, all of the nurses and support staff made my job really easy. So I am just here to answer any questions. I talk to families all the time, in the nursery and in the hospital, kind of wondering what their next best step is. And so I'm happy to answer any questions that people have about, is this safe? Have we researched these? What's the risk? And to, be a part of your research. So that's why I'm here.
Okay, and we'll definitely have an opportunity to hear more from you when we start getting some of these questions posted. So before we move into the question part of the program, we are going to introduce Kristen and Greg, and they are going to walk us through these measles resources, these mini videos that have been created. And then we'll go into the questions. But let me first introduce Dr. Greg Holtzman. So Dr. Holtzman's a board certified physician in both family medicine and preventive medicine, general public health, and the former state medical officer for Montana. And he's now working with us part-time at the University of Montana and helping us provide a lot of technical expertise related to things like the measles outbreak. So next up, we have Kristen Cram. So Kristen went to graduate school here at the University of Montana, where she received a dual master's degree in both public health and public administration. And she currently works here at the University of Montana for our training center as the Prevention Specialist Technical Assistance Manager for the Regional Technical Assistance Center. So I will let them take it away.
Thank you, Tony. So just real quickly, so we can get into the questions, but I think this is something that we've started here at the training center, and there's a lot of other great training materials at the training center, but trying to reach out and work with the community of some of the major issues that are going on. We thought that measles, when this first started hitting the United States and more specifically Montana, that we'd put this together. So we have a bunch of different interviews that we've done with very common questions focused on to the general public, but also some of the questions are focused to physicians and other healthcare providers, along with institutions that might have to deal with a case where what do we do when one person comes in and we find out that we have a measles case that has been at this clinic or has been in this school or something of that sort. So I'll let Kristen show you just a little bit of how they're set up, but there's full videos that go about 20 minutes, I think is the longest, or you can watch each individual question, many of those being less than a minute, maybe some of them going up to 2 or 3 minutes, where we've talked with ID physicians, infectious disease physicians. We've talked with public health experts at the state and at local public health and others in our community. So with that, I'll hand it over to my colleague, Kristen, to show you just a little bit of what's here.
Yes. Hi, Greg, or thanks, Greg, and hi, everyone. So sorry, I'm kind of distracted hearing my voice echo from Anna and Tony in the same room as me, but they muted it, so I'm good now. So kind of my role with the measles resource here that you see is putting these videos together. So Tony interviewed a bunch of public health professionals and physicians across Montana, and my job and task was to bring it all together and make it more digestible so that it could be a resource for the public to use. And with my colleague Anna Kiley and her skills with Cascade, which is the website for the University of Montana, she was able to create this web page under the Montana Public Health Training Center website. So I try to kind of show you how I got there, if anyone was paying attention, but it's not always like straightforward, and that's purely on Cascade's deal, not Anna. Anna did wonderfully with this website. But as you can see here, we have a little announcement regarding our webinar today. But if you scroll down, these are the interviews, and we have 4 main parts. Basics of measles is really just focusing on, like, what is measles? How does one contract measles? So on and so forth. So stuff you could pretty easily look up on like the CDC if you're just wanting that quick information. But you can just click on this and it'll show you the clip to the answer to that specific question alone. But if you rather not click through each one and you just want to see the whole video, you could also click on this link here. And so I'll also show you just a little bit more of what we have here. So risk, exposure, and response. This might be more where people are interested. The questions include, I've been told someone in my household has measles. What should I do? Like those kind of questions are more ambiguous, I think. Something we kind of learned from COVID-19, oh my gosh, I was in a room with someone who had COVID. What do I do? That was very uncertain. So with this, we try to make it more clear and kind of straightforward for everyone. And again, there's a full video, or you can just, click on this link and just watch the answer to that specific question. We have this coming soon. It is done. We are just waiting on final permissions from everyone so that we can officially post it. And then here, this is more for like providers and like health departments. These questions include, what are some recommended protocols for responding to a suspected measles case in emergency rooms, urgent cares, etc. I'm only going to give you bits and pieces of some questions that we have here because we have a lot, and I won't read all of them to you. But what I would like to do is show you a video and just kind of a quick, here, I'll show this one, what it looks like. First, can you guys hear that? No? Okay. Well, I'll just show you quickly. It's a quick, 25-second video. So in this video, you can see she's answering the question, but you can't hear the sound, and I apologize for that. I'm not the most tech savvy of all of us here, but that's all I have. And so if you guys want to also look down here, all the way down below all these videos, we have resources. If you guys just want to learn more information, that reliable resources that are provided on here as well. So Greg, did I miss anything that you wanted to add?
No, I think that's good, and people can go there. The only thing we'll add on there is these are something that if you find valuable or also think there's ways that we can improve it, we'd like to know, because we might try and do this for other things that come up in the community if this is a benefit for our colleagues across Montana. So this is the first time trying it, and we'd love to get some feedback from you. So thank you.
Yes. I also want to add that, a disclaimer that this is just general informational videos, and you should not like replace it as advice from a professional, like medical advice, diagnosis, treatment, things like that. You should consult your own physician regarding those types of questions, but this is more just informational. So that's all I have. Thank you, everyone.
Thank you, Greg and Kristen. And Jessica, I know you had some really great resources there, and we will certainly, if they're not already in the resource library, we can pop those in as well. And if anybody else on the panel or others on this Zoom has other great resources that you go to, please send them our way, and we'll put them in this this resource library. And it's meant to be like anybody in Montana, if you have questions, they go to a central location. So we're all working with the latest and greatest information. Okay, so now we're gonna go to the fun part and start proposing some questions to our panelists. And like I said, we started out with a lot of questions that were submitted when people registered, and we've had some others that have come in. Our first question is to the panelists: if our school has 98% vaccinated, do we have herd immunity? Aaron, go ahead.
Yes, yes, we have this kind of you know, arbitrary number, 95%.
Aaron, I'm not hearing you. Can you hear it? Okay.
You can't, can you guys hear me? You can hear me? Okay. Okay, that threw me off a little bit. Yes, essentially, I mean, we look at the number of 95%, and if you have that 95% for, you know, for measles, we could say, oh, yes, we have some herd immunity. And basically, though, we just remember that nothing is 100%, right? So you still need to take protective measures. You still need to look at everything. You still need to investigate. So that doesn't mean that your school is excluded from, you know, from us coming in if there is a case and trying to make sure that everybody is protected. But that gives you a pretty good veil of protection at that 98%.
Thank you, Aaron. And Brooke, I saw that you had raised your hand. Did you want to add anything to that?
No, I think she covered it beautifully.
All right, well done. Okay, so our next question is, I'm a district secretary in a public school. Process and recommendations for those who have chosen an exemption. Yeah, go ahead, Brooke.
Okay, so if you're working for a public school and somebody has an exemption and it's a valid exemption, they have a right to do that. It's just really important to keep that on file, have those lists ready of those kids who have an exemption, because even though they have a right to be at school with that exemption, they still are unimmunized. So if a case does pop up in the school or in the community, we want to be able to contact those kids, those families, quickly, and take protection measures for them, just as we would any other unvaccinated person.
Okay, thank you, Brooke. So next question, how does the measles vaccine actually work? Why do I need boosters with some vaccines like pertussis and tetanus, but not vaccines like measles? Dr. Moriarty.
That's a great question. It feels like we give a lot of shots. So the measles vaccine is an interesting one and has been around for the last 70 years or so, as some of the other presenters talked about. But the measles vaccine works by, and I usually explain it, vaccines work by kind of giving like a piece of a virus that fits into, and then our body kind of creates the lock for it. And so then the next time that you are exposed to that virus, you already have the lock ready and it doesn't spread within your body. The reason that we give boosters for certain vaccines and not for others is because we've studied over time in the course of having many vaccines around, the amount of immunity that we have. So for example, the Tdap vaccine, you tend to have waning immunity around 10 years. And then there's other circumstances that are pretty individual for boosters for that. And so it really, and I think there's been a lot of questions about like, gosh, how well do we study these things? And the vaccine schedule is built around that. When do we have the most robust immune response to that, which is usually when we're young. That's why pediatricians are always trying to get you to vaccinate your kids. our immunity wanes over time. So we try to give all those vaccines early, and then the immunity that does wane, that's why we give a booster. And some of that immunity wanes and some of it doesn't. And that's how our bodies work. And the other thing that I just wanted to quickly say that I know has also been in the news is that we should go back to whole virus vaccines. Actually, the interesting thing about those, and you would think, gosh, why wouldn't we just give the whole virus instead of like a lot of tiny little pieces? We actually don't get as good of an immune response from the whole thing. But when we have lots of pieces, when you think about like, gosh, like if you threw one ball onto a gym floor versus like a bunch of marbles, how it would affect your body and all the different locks that we could create in that way. And so we abandoned the whole virus vaccine theory a while ago because they just weren't working as well, and it was harder to make vaccines in that way. So so when we're thinking about how vaccines are made now and you hear that stuff in the news, that's why.
Yeah, thank you. So another question. I'm a teacher who is currently pregnant and not immune to measles despite vaccines. What can I do to protect myself? Can I notify my principal superintendent so I'm notified if there's a risk of me being exposed to measles? How about rubella? Jessica.
Thanks. So one thing we look at when we find if we have a case of measles is we look at who is exposed and what their risk is for measles. Somebody who is fully vaccinated with at least 2 doses of MMR and pregnant, there's really nothing you would need to do, although we always encourage you to reach out to your medical provider who's caring for you during your pregnancy to just check in with them during that time. If you're not vaccinated and you're pregnant, there are what we call post-exposure prophylaxis or PEP that we can give that sometimes helps prevent measles infection, but it's best given shortly after after you're exposed to the virus. So really keeping communication with your principal, your staff, keeping that communication open. I know public health, as soon as we know about something, we are on the phone with the local public health department. Local public health is on the phone with the schools. It's like we try to make sure that we're always in communication so that we have the most up-to-date information to the people who need it right away.
Thank you, Jessica. So what's the best course of action for exposure with infants that are too young for the vaccine? So Dr. Holzman.
I just wanted to go back to the last question, just because I think in the beginning, if I read it correctly, this individual has gotten vaccinated, but for some reason, sounds like she might be in the 3% that didn't get active immunity, didn't get antibodies to it. So just to add on to what Jessica stated, I would let the people around you know, so that they don't just look at your vaccine record and say, oh, they're immune, because it sounds like you have a special situation here. And as Jessica stated, I would keep in close contact with your provider, because if you did have a close exposure, they may want to move with something if they know that you have not had an immune response. Thanks.
Dr. Moriarty.
Yeah. So it's just so everybody knows, so I'm a pediatric hospitalist. So I take care of sick kids and I also take care of newborn babies. And so I have this conversation about the measles 5 or 6 times a day, sometimes 10 times a day, as I discharge babies from the hospital. So if you are immunized as a mom, that is great. Because there is some placental passage of antibodies for measles from you to your baby. And so you've already given them immunity, and that lasts for about 5 to 6 months. So great. So as you leave the hospital with your newborn, you don't have to worry about measles, and you have to worry about other things. I won't, but you don't have to worry about measles as much. Now, where it becomes really important, is around that 6-month mark. We don't vaccinate before 6 months because in general, babies have had immunity from moms for many years, and we haven't studied before 6 months, um, but before this outbreak, even we were immunizing, babies that were going abroad, traveling and going, there was measles in the area, so we would vaccinate them. Where it becomes really important here in Montana in the setting of an outbreak is that measles, when we talk about it being really contagious, it hangs in the air for 2 hours. You have a 90% chance of getting it if you're unimmunized. So that means for our babies that were born a couple months ago, they're going to hit that 6-month mark during Christmas time. And so they're going to go into Target or Costco when it's so busy, and you just don't know who walked in before you. Okay. And that is a risky situation. So what we are recommending is to talk to your pediatrician. We are watching this situation really, really carefully for all of these outbreaks. And at your 6-month well child visit, or even at your 4-month well child visit, or whenever you're seeing them, ask these questions, get ready, get the information, and say, what is going on with the outbreak? Look at these resources here. And then we're recommending an early extra MMR vaccine. And I say extra because you'll end up getting 3. And I promise you, it doesn't cause autism. I wouldn't have vaccinated my own kids if it did. And I wouldn't recommend it as it did. I just want your kids to be healthy. So we're recommending a vaccine at 6 months, and then they'll get another one at a year, and then another one like 4 to 5 year well child check before kindergarten with their kindergarten shots. So don't fret too much about the measles if you have a 2 or 3 month old, but start to fret in a couple months.
All right, thank you. So if a measles case is identified in our community, what is the best way for schools to communicate with local health department, parents, and staff to ensure accurate and timely information? Lauren. And then
Okay, yeah, great question. So, the second that measles is suspected, regardless of suspicion level, local public health departments are going to want to know promptly. And that's just because we're able to kind of assess what that risk is, ask the right questions, and coordinate those next steps. Health departments are really well connected, typically with area providers and individuals who may be testing these individuals for measles. And so, there's a chance that the local health department may already and most likely already knows when rule outs for measles or someone who is suspected to have measles that has had testing is in process. So, if as long as you're following up with your health department promptly and following local recommendations for what that looks like for your own specific department, the health department can help kind of identify those next steps for you, what questions to ask, what measures to put in place. And they're going to work really closely with your school to provide the information needed. And then, of course, if the case were to be identified as being positive, the next steps and all communications that will go out to staff, parents, guardians, and community members. Just that partnership with your local health department is going to be really key in these situations.
great, thanks, Lauren. Brooke, did you have anything to add?
No, I don't think so.
Okay, Gina.
I just wanted to add or emphasize, I suppose, that the best way to communicate is the quickest way you can find when it comes to local public health. So although, as you saw in some of the statewide maps, Missoula hasn't had a confirmed case, boy, we've had a lot of fire drills. So when we have a suspected case and we're waiting for those test results to come back in, we don't just kind of sit on our hands and hope that it's not one. We get right in there and we figure out, like Lauren was talking about, what is the risk? If this comes back positive, we want to be ready straight away with messaging and connecting with people we need to connect with to kind of put a ring around that. So I think a lot of health departments have kind of a preferred way, or maybe a portal. I think Missoula County has like a jot form link on their website to report communicable diseases that providers use all the time. But for folks in schools and that kind of thing, we have an infectious disease line and it's always staffed. So having those relationships ahead of time, and maybe even before you have a case, call your health department and figure out what the fastest way to do that what would that look like, both during business hours and then as well after hours and on the weekends.
Thanks, Gina. Lauren.
Yeah, the only other thing that I'll add that I think has been largely beneficial in Gallatin responding to our cases so far is really treating suspect cases as true cases until we know otherwise. It is so much easier to put proactive measures in place and follow the guidance for, to treat this as a true case than it is to, backtrack and have so many extra exposures that could have been prevented. So I guess the most important thing is really call us, call local health departments and ask all those questions and treat the case as if it is a true measles case again until we know otherwise. And I think another thing is, and I'm happy to let, Jessica or anyone else on the call speak to this, but you don't have to look for a check to every single one of those boxes in measles criteria. What we know is that it presents differently in individuals. If individuals do already have some immunity to measles and are also having infection, they may have a modified response that doesn't have all of the classic measles symptoms. So it's really important to just engage with the care provider, with local public health, ask all the right questions that you can, and treat the case as a suspect case until we know otherwise.
Thank you, Lauren. Jessica.
Thanks. One thing that schools really can do beforehand is prepare those letters that you're going to send out to your community, to your parents, to your guardians. Write those letters today and put them in a file and hope you'd never need them. That way, if this comes up and you have a kiddo that turns out they do have measles, that letter's written. You just have to pop in a couple details and it's done. And you've done all of your homework already. So you're not starting kind of behind. You have things prepared.
Go ahead, Brooke.
And I will add that in the toolkit that DPHHS provided, there are some template letters, and at MCPS, we do have those letters ready to go in the case there's a suspected or actual case.
Okay, great. It's a lot of good advice there. Next question is, isn't natural immunity better? Can I take my child to a measles party? Dr. Moriarty.
Yeah, that's such a great question. And some of us are of the generation that, we used to have chicken pox parties. But really it's so interesting. So you are running a risk by just exposing yourself or your children to measles and just hoping that they get sick, because you're also hoping they don't get really sick. Because as other people showed us earlier, there's a spectrum of disease. And I think that we don't do a great job communicating that sometimes. When you hear a soundbite that we say everybody will die, that's not true. Some kids will come out of it okay. Some kids get hospitalized. Some kids, but it is a gamble. And with vaccines in general, you get a much, much, much smaller dose of whatever is infectious, the smallest dose to give you the largest amount of immunity and no illness associated. And so there's no cases of severe measles from the measles vaccine because of how it's made. And so we don't recommend going to a measles party. Natural immunity doesn't tend, you just don't know what you're going to get. And also you don't know who's there and what their immunity looks like. And so I think that, again, like thinking about our neighbors and our community and the people around us is really important in that setting too.
Thank you. I'm not sure I've heard of a measles party, but I don't think I want to go. So we have another question. And I might call on Nick Dimitrovich to answer this one. So the new law from the last legislative session does not allow or require daycares to keep immunization records for their staff. I'm unsure if school districts must follow this as well. How should daycares or schools, if applicable, be aware of who is at risk and have an accurate response to a confirmed case in light of this? Let me introduce Nick real fast. So Nick is an attorney based out of Helena. So Nick has spent his career, he started out clerking at the Montana Supreme Court, then spent a decade at the State Health Department, where he worked in public health and disability law and served as the department's deputy chief and chief legal counsel. So we invited Nick to attend the panel and to kind of help us kind of think through and provide guidance on some of these legal type questions. So Nick, you want to take a stab at this one?
Sure, thank you, Tony. That's a great question, and it is true that in under some rules that were introduced by the department in 2023 and that became effective the first day after this last legislative session earlier this spring, the staff immunization record requirement for daycare licensure was eliminated. There's also the component of the question that asks about school districts. That has never been a requirement as far as I know for school districts. So if you look at Title 20 in the People Health statutes, those statutes have always strictly just talked about immunization records for the pupils at the school and not the staff itself. One thing I would say about daycares is that the new rules and the rules prior to this do apply the management of illness requirements to staff. So it's very similar to if what you would look at for a kiddo. So if they show up and they've got a fever of, and I'm trying to remember, I can't remember exactly what it is in the rules, or if they've had a rash. There's I can't remember off the top of my head what the different, there's 7 or 8 different requirements. You can screen them out and you're supposed to send that staff home too as well. And that's unfortunately under the existing legal framework about the best you can do with staff. I have a hope that maybe the department might reconsider some of those rules down the line. I think that there was some legal analysis that was done to determine that they couldn't ask that of staff that I don't know that I agree with, but I think right now, some of the best practices that we've already heard some of the great presenters talk about, in terms of just being prepared in advance, like paying attention to the individual needs of the kiddos in your care and your staff members in advance and knowing what they are. And then responding quickly to symptoms is probably about the best we can do right now.
Okay, thank you, Nick. Next question. What should I do if I think my child has measles? Should I take them to the emergency department? Jessica?
Thanks. This is a really great question because measles is so infectious to others, we want to prevent exposures before they happen. If you have a child or anyone who is sick and you think they might have measles, you want to talk to your medical provider. You want to call your local public health. You want to get somebody on the phone and get, hey, I think my kid has measles. This is what's going on. Maybe we traveled, maybe something happened. This is what my kid is experiencing today. Not every person needs to go to the emergency room for measles. However, if your kid is experiencing difficulty breathing, their lips are blue, they're not eating or drinking, like these are emergency signs that anybody else would go to the emergency room, we still want you to take them to the emergency room. And when you arrive, you say, I think my kid has measles, before anything else happens. That way they can get you guys into a room where you're not exposing other people in that waiting room. Because we want to care for your child safely while we're not exposing other people to measles, because we don't know who else is in that waiting room. But like I said, not everybody needs to go to the emergency room. We do want to test somebody for measles if they think they might have measles, though. And that can be done either at your provider's office, again, calling ahead, making arrangements. We've been doing a lot of what we call parking lot testing. The primary test for measles is either a nose or a throat swab. I know we're real familiar with those after COVID. And that can be done in a car. So you don't, if you're somewhat ill, but you're not ill enough to need immediate medical attention, you're not vomiting, you don't have a middle ear infection, that kind of stuff, and you're well enough to be home, there's ways that we can keep the exposures to a minimum while also making sure that you're cared for, and confirming that you are indeed sick with measles so that we can help protect your community and your family.
Okay, thank you, Jessica. Okay, next question. Should I give my child vitamin A to prevent measles? Addie.
The short answer is no. Okay, and the long answer is that yes, there was a study done in vitamin A deficient children, and I believe it was in Africa, that showed that there was some additional protection against measles in that specific population. And I think it's really easy to think because it worked in one place, it'll work everywhere. That's not the case. And that's a conversation you want to have definitely with your pediatrician, because there are dosing recommendations if you decide to try that. Vitamin A is something called a fat soluble vitamin. It's like vitamin D, E, and K. And so we store it in our body. And so we've seen some really bad complications from people just dosing vitamin A off of, dosing schedules on the internet or social media. And so really, like, when you're thinking about the risks and benefits, it can be dangerous to just willy-nilly dose vitamin A. So we really recommend that, number one, you don't do that. And then because it's probably not very effective for us in the United States that eat a relatively healthy diet and have vitamin A in it and enriched foods. So probably not helpful. And then second, it can be harmful. And so yeah, add us into your research when you're thinking about stuff like that.
Okay, thank you. Next question is, if we're not sure whether an illness is truly measles, what key information should schools collect and share with the health department? Lauren.
Okay, so again, like I said earlier in my presentation, schools may be the first individuals to become familiar that a parent may be suspecting measles. Maybe that kiddo woke up with, symptoms that morning and they're calling the school first. So, some really great questions that can help public health officials kind of think about next steps are going to be. Has there been any recent travel for that individual? Have there been visitors from out of town? And do we know whether or not this individual has had an exposure to measles? Have they been in a location that was predetermined as what we call public exposure sites, where someone with measles was during a certain time frame that maybe exposed the susceptible population there? What symptoms are present in that individual and when did they begin? That when did they begin is really also helpful for us to determine as well. And measles likes to, in most cases, follow a very typical progression, and it can also differ from that. So, kind of when those symptoms are beginning and what those symptoms are really important pieces of information for us. And does this individual have immunity? And what does that immunity look like? And was the child recently vaccinated? And then also, are there other household members that are experiencing illness? Does this individual, this sick kiddo, also have two other siblings who tested positive for a different respiratory illness earlier in the week and now they're exhibiting similar symptoms? These are all kind of the beginning details that they're really helpful for public health to know, to start thinking about whether or not this warrants testing and next steps for the family. And like I said before, when in doubt, treat it as if it's a suspected case until we have more information. But it's strongly encouraged that you have those conversations with the school nurses and again the public health department. And of course, can't reiterate it enough, are the area care providers and kiddos providers are going to be great wealths of knowledge to help walk you through next steps and what that looks like to protect kiddos in the school community.
All right, thank you, Lauren. Next question. So what should we do if our school doesn't want us contacting the health department? Gina.
I am not entirely sure that my response will answer this question, but in terms of a school or other provider contacting the health department, there's not an option to not report this disease and a whole host of others to the local health department. It's required. It's required by state law. So if that is something that you think might be going on in your community, geez, I almost might call in Nick. But if the question is more broad, if the school isn't encouraging preparation or solid communication and consensus building with their health department, that's a different question. But I suppose my point is that there isn't actually an option to not report measles.
Thanks, Gina. Next question is, why do we start giving vaccines so early? Addie.
Yeah, so I kind of alluded to this in how is measles vaccine made? And we do it because kids are healthy and they develop a really robust immune response and that lasts for a long time. And so I run into this all the time that people are like, no, it's too early. I'm gonna space out the vaccines. And really um I think and I am a mom too. So, and my heart hurts when my kids get poked with anything. I have to look away, to be honest. And I see this all the time. So I get it. I really do. But I think that, the only benefit to kind of spacing out vaccines or, there really is for our own hearts. It gives our kids, more time that they're at risk for certain things. And we're talking a lot about measles today, but I mean, we vaccinate against all sorts of stuff. And I've seen kids with pertussis, I've seen kids with rotavirus, really nasty things, that I promise you, as a mom who's taking care of these kids in the hospital, you don't want them to get. And so, um, and I also promise you that I'm too tired and busy to develop a conspiracy around them. And there's no other reason for me to give them. So, we give them early because that's when they work best.
Great, thank you. Next question. Any specific recommendations for pediatric offices to consider during back to school? Brooke.
I would love it if a pediatrician's office would give them a great copy of their immunization right then and there, and then really encourage them to sign the MTRAX consent form and get that vaccination in the MTRAX system. That helps a lot.
Thanks, Brooke. Will you be sending this recording out? This has been amazing. We definitely will make this recording available to everybody. We will put it on our website, and we'll also send it out via through the training center listserv and through other mechanisms. If you don't see it, just contact us directly. We'll make sure you get the recording. How can schools help educate parents to keep sick kids at home? Aaron.
Well, one of the things that I recommend is that you communicate really effectively with your parents. What I was doing, I was putting together a newsletter that went out, especially during our real sick season, and keeping everybody apprised of what is going around, right? So what we're seeing a lot of, so that parents could know what's out there, and then you could take the proper precautions, essentially. But so having some kind of a plan with how you do communicate with parents is already, a lot of schools already have that. And then the other thing is just having strong policies in place that, that you already have, that your parents sign those books at the beginning, of the school year, and they already know, okay, here's our exclusion criteria for when we're sick. This is what it looks like. And schools can have strong policy, stronger than, there's really no arm, I don't think, for schools, the administrative rules. There is for daycares, but not for schools. So you have to put that into your policy and make sure that it's really strong. And some of the things that I recommend is that you maybe even add in there other exclusion criteria may apply based on local public health recommendations. That way it's kind of, you allow for, if there is a interesting rash going around, typically that's not something that we look as exclusion criteria, but maybe it is if we're seeing more measles cases, but just kind of opening up some possibilities there. But the other thing with that is looking at your absenteeism policies as well. So that way you're not contradicting yourself. Like, we want you to stay home when you're sick, but also here's a letter that says you've been gone for 6 days. And that's really frustrating for parents. So you have to kind of weigh that. You have to balance both of those, but just being very honest about what is going around your school and keeping those parents up to date as soon as possible. I think I answered the question, maybe.
Thank you, Aaron. Next question, for parents, grandparents, faculty, etc., what should one do if they don't know their vaccine status? Jessica, and then Aaron.
Yeah. So I actually had to do this with my husband because we couldn't find his vaccine records. We called his high school in Colorado. So that's one thing. Go to where you know your vaccine records are, your high school, where you were vaccinated. If you're, your pediatrician's office from when you were a kid, they may still have records of these things. State registries have the newer records. So your kiddos probably, their records could be there. But yeah, follow where they were. If you can't find records and you really don't know, was I vaccinated for this? Talk to your medical provider. They can have a risk-based discussion. They might be able to do some blood testing to see if you have immunity, or they may just recommend that you get a dose of MMR. MMR is very safe to receive a single extra dose if you were to have previous doses. And we know that one dose does give 93% effectiveness against the measles virus, and one dose is considered for adults to be up to date with vaccine for measles.
The only thing that I would add to that is you can also call your local public health department and we'll try to help you track down those records. But she said everything else that I was going to say too. So that's about it.
And Gina, did you have more to add?
Oh, I couldn't get my hand lowered in time. Not really. I
I'm really
suppose
watching.
if you're in Missoula, there's a link on our website. You can actually request forms, and our public health nurses will do that digging and email you what records we can find and help counsel folks who may not be in MTRACs and we're not able to, find their records easily. We kind of do that one-on-one conversation similar to what Jessica was talking about, and walking through your history and helping you identify places to call.
Thank you. Another question. We have spoken quite a bit about measles vaccine. Are there other vaccines we should consider for our children going into the fall? Eddie.
Yes. Yes. There definitely are. And the really great, like amazing thing in medicine right now is that the most common, and I guess it really depends on the age of your child, but the most common illnesses that kids get hospitalized for, we have vaccines for now, and so it's preventable. So those for kids under the age of 2 are the RSV vaccine, and that's available to moms when they're pregnant, and then also the antibody shot is available for kids in their first RSV season for 0 to 8 months. There's some other criteria that make you eligible in a different age, but you can talk to your pediatrician about that. And then secondly, the flu vaccine. I know everybody has a story about the flu vaccine. The flu vaccine does not give you the flu. That's not how it works. You might catch something else, but so the flu vaccine and then the COVID vaccine too. So there's a lot on social media about the COVID vaccine and changes to recommendations. We recommend getting the COVID vaccine, even for healthy kids, because it helps prevent it. And again, you don't know how sick you're going to get. So those are ones to consider. Those are ones to consider going back to school for sure, and catch up on stuff that you're behind on. It's such a low risk situation.
Thank you. So question about Texas. So why did they say on the news the other day that the measles outbreak is over in Texas? Does that mean we are safe now here in Montana? Jessica.
Great, yes. Which this is excellent news for Texas. So what this means, an outbreak of measles means that there's continuous transmission of at least 3 cases that is ongoing for a period of time. The outbreak in Texas, it spread both to New Mexico and Oklahoma, and we suspect it might have actually spread into Mexico too. But they had continuous transmission that eventually slowed. And the way we call an outbreak of measles over is we wait 2 incubation periods of that illness with no new cases being diagnosed. So for measles, the incubation period is up to 21 days. So the Texas outbreak has waited 42 days and they have had no new cases diagnosed. And even previous to that, their case numbers were slowing down considerably in the weeks coming up to this 42-day period with no new cases. But that is only for that local area. Montana, we have 1 current case of measles that was diagnosed recently. So it's not considered an outbreak because we don't have 3 or more in a transmission line, but we have recent activity. So we're kind of on high alert. We're looking for new cases related to this, even though we've had limited exposures in our state. We're also kind of on the lookout because we know our population travels. We have people who travel for weddings, for events, for funerals, for a lot of people are finishing up their summer vacations. They're coming back because the kids can start school here shortly. And whenever we travel, we're meeting new people. And we don't know if those new people might have measles. And so that's where I expect to continue to see these one-off cases where somebody has traveled or has a traveler come into Montana who unfortunately contracts a case of measles. And then we respond to that by protecting our community with these different public health actions that we make. So the long answer is it's great for Texas. It doesn't really change our response here in Montana, though. We're still being very vigilant. We're still testing people daily for measles here at our state public health lab. And we're really being very vigilant and on the lookout for people who may be experiencing measles illness so that we can protect our communities.
Thanks, Jessica. Next question. What is one of the biggest concerns you have been hearing from schools regarding potential measles outbreaks? Aaron.
So I think that there's still there's a lot of fear, I guess, with schools because of what we just went through 5 years ago. And that pandemic really laid into everyone in the whole world, really, and changed a lot of things. And nobody had experienced that before. And so one of the big questions, you know, is like, well, are you going to shut us down again? And do we have to prepare for that type of thing? And you know, the short answer is no, that's not the goal at all, you know, and this is not that. What we're experiencing now is very different from what we experienced 5 years ago in the pandemic, right? That was a new thing. We had no immunity in our population. That was very different. This is an old thing, and we have a great level of immunity in our population, plus a really awesome vaccine that we can get people up to date if needed. So you know, I want to ease that fear in schools, and I want to make sure that they know, yes, please contact us. That is not the goal at all. I think there's a very, very, very low risk that we're going to have to shut any schools down because we have that 94, 95, 98%, you know, immunity, that veil of protection. And so I think that we just need to be very open with each other and make sure that fear is not holding us back from that communication piece.
Awesome. Thank you, Aaron. And this last call for questions. We're kind of winding down the amount of questions that we have to get through. So thank you everybody for submitting questions, and thank you to the panelists for answering the questions. So we're maybe going to answer one, or I think we have one more question.
Thanks, Tony. And as I was reviewing them, I think it's one that I had already asked. So as you mentioned, we'll give folks a couple minutes to put in any last questions they might have. And in the meantime, we will be following this meeting today with a link to the recording. Please share with your networks and anyone that you think could benefit from this information. We'll provide all the resources that the panelists spoke about today. And then we'll also send you an evaluation. As Dr. Holtzman mentioned, we would like to know whether there's an appetite within our communities across Montana for more panel discussions like this, not necessarily focused on measles, but on potentially any other public health issues or concerns, and we would welcome your feedback and ideas regarding that as well.
Okay, no more questions have been submitted, so I would just like to thank the panelists. You guys did an amazing job, and thanks for everybody for sticking with us for an hour and 41 minutes. And stay safe out there. If you have additional questions, you can send them directly to me. I will make sure that that we send it to the right person to get your questions answered. But other than that, thank you very much, everybody, and stay safe. Have a good night.